Because we had a glitch in the agenda and we called her up and then we had other folks. Wait, 1 minute. So we want to try to get back on time because we have some folks that will need to leave that have important reasons that they need to leave. So we want to try to get back into the swing of what the natural agenda was. So give me 1 moment. Okay. Is it warming up? Let's hope so. I hear it.
Why don't you introduce Deborah?
So my name is Rachel Rule, and I like to call myself a facilitator rather than the project director because I really feel like this project wouldn't exist if it weren't for the women here and having a collective voice. I honestly mean it. I don't do this work alone. At meetings, we're always asking for input. We designed this project together. This wasn't my vision. This vision has existed for centuries. Community doulas run by Black women are national. They're already happening. So I just oversee it. I'm the supporter, I'm the facilitator. So I oversee SPAN's, or I support SPAN's Community Doula Program. And what do we do? So SPAN is a leadership organization for parents. And when I came into the position, and I knew of the disparities because I became a community doula 9 years ago in Jersey City through another DOH initiative. And I have a lot of sisters around me that are very committed to this work. And so I know that disparities exist, and I know why it exists. And so I kept approaching the organization saying, we need to do this, we can't sit still, we have to do this. And after some time, I got folks to move. And the organization said, yes, we're gonna do this. So we took a very small part of money of our grant, and it was aligned. We did some brief conversations with the community about community doulas, and they said, why doesn't this program exist? If we know it works, why doesn't it exist? And that's a really good question, so then we just acted on it. So what is our community doula program? We employ women who are trusted members from the community. They extend and intensify the role of the doula with the family from pregnancy through postpartum. We collaboratively approach. We work with community stakeholders. One of them is University Hospital. We meet with them quarterly. It's part of our policy. We've created an IPO community doula policy that exists in University Hospital. And we meet with them quarterly, and we talk about real issues. We talk about residents, we talk about doctors, we talk about bedside manner, we talk about real deal issues. And you know what? The doctors in that hospital listens. It takes time to change, but the hospital listens, and they're moving, and they're trying. With all of the pressure that they have, they are trying. We facilitate experiential learning, and we value the doula's work. Doula's work should be paid more. We do not pay them enough, and I want to acknowledge that, but it's something. And these sisters are committed to the community. So that's why they do it underpaid, but they really should be paid more. So we supervise, we have community doula meetings that are monthly, and anytime they need to pick up the phone, they call each other. And in the event it's 3 o'clock in the morning and they're out of birth and they really need support, they can call me or another sister. So what do? We have supplemental trainings. We provide anatomy and physiology for doulas, reproductive health. One of our sister trainers here, Elena Broach, she's in the back. She provides our reproductive health and childbirth education training. We have self-care for doulas. hands-on skills for doulas that Chanel does again. We have another one. I don't think any doula program should exist without an allyship or white privilege or a deconstructing racism project. It needs to be connected to the Community Doula program. So Community Doula program, the way that I see it as a 3-component thing. You need communities to invest in it. So part of that means engaging community outside of the community doulas. Then you have a deconstructing allyship and white privilege that is a part of this doula training, and then you have the doula training. That's how we reduce disparities. We have navigating the maternity healthcare system, breastfeeding education that Vicki Neisen does, and we have kinetic yoga training from a sister, Jeanette Rodriguez, and I'm trying to remember the name of her organization. Help me.
Omega Fruits?
Fruits of Life Yoga, Omega Fruits. She does kinetic yoga, which is aligned with Black folk, kinetic yoga. So that's why we chose to do it in this community. SPAN's Community Doula program, we live and work within, the doula has to live or work within Essex County. They work in pairs of 2 and sometimes 3 because they have to be paired with a community health worker. Community health workers address the struggles and the issues that a resilient woman is going through. And then we have the doulas that go to all visits together. We provide a stipend for 4 births, and we provide, the last birth is a give back to the community. We do 2 prenatal visits. It should be much more than this. We should be doing 4, 5, 6 prenatal visits. And then you spoke of look and listen after a mother is born. We should be following up with her after that. So we need more money so we can do more prenatal and postpartum visits. We provide uninterrupted labor support. The doulas that are going to be called up, some of them have been at birth for 26 hours, 27, 30 hours, and they're at the births. They don't leave. They have to attend all supplemental trainings, and they provide supervision whenever they need it and support meetings. There is Vicki providing a workshop. Okay, so to date we've had about 44 referrals to our program. Due to our capacity, we are unable, we just don't have enough doulas to serve enough moms. We should be doing 10 to 15 births a month, maybe even 20 in some times. But we just didn't have enough capacity. So we provided 27 women in Essex County with births, with uninterrupted labor support. 18 of them were Black women from the African or African diaspora. 7 are Latina women. We had 1 Asian woman and one white woman. We don't turn a woman away, but we do prioritize women of color getting doula support. The outcomes, we've had 24 women initiate breastfeeding. We've had 3 C-sections, 2 preterm births, and 2 NICU admissions. We have not had any deaths, no. Hospital partners, University, Beth Israel, Morristown Memorial, and Overlook. Our best births that the doulas report is we are seeing moves at University Hospital. They are trying, they're working with us, but our best births where women are able to walk during labor. This is a necessity. Women have to walk. Women shouldn't be separated from their baby. There are so many things that hospitals need to change in policy, but Morristown and Overlook, though culturally they might not understand a woman all the time, that's why the doula is there. We do have our best option for births there because women are able to walk and drink water and eat. Our referrals are coming from the community health workers, University Hospital in East Orangewick. And these are our partners. So I'd like to move very rapidly into the most important part, which is to find the awards.
Deborah.
Oh, right.
Yes.
Doesn't Deborah want to speak?
Yeah. Yes, I see them. Okay. So, okay. Quickly, why I'm waiting here and getting these is that I am not from Essex County. I didn't grow up here. My people aren't from here. But I've learned is that you have to listen to people. If you really want community and you really want people to engage, is that you really have to listen to people. And listening means that you do something about it after. You don't just listen and then go off on another agenda. So I think it's important that we all listen to Black women. It's very important that we listen to Black women and take this work very seriously. It can't just be work. It has to go home with you. And it has to be when you're standing at Target, and the way we treat our people, the way we treat people every day of our lives, because those are the issues. Is that how we treat people every day of our life? So we need to do a better job at listening to Black women. Once I'm done with the award, I would like to bring up the co-executive director, Deborah Jennings. And I would like to also recognize Pamela Clark from Newark Community Health Center. Thank you for coming. Thank you. So could all of the community doulas come up here? I have been waiting to do this. Could I invite all the community doulas up here? And at our community doula training, you are allowed to bring your children. So Chanel had her other daughter, had a daughter, and she was in a pack and play. And we had other people that brought their children that were jumping on birth balls and so forth. So I am not going to introduce you. I'm only going to do the first person, and I'm asking you to introduce each other. Okay. So who do I have the honor? Joanna Guzman.
Gloria Nieves.
Rachel Jean Miles.
Aurelis Martinez. Catherine Sarmiento. Unique Downs. Tatiana Smith. Oh, Danielle Amani Abdullah.
Do the next one, do the next one. Do the next one.
Jessica Alyssa.
Do any of you want to briefly say something?
These are righteous sisters here, and I give thanks for working with them. Yeah.
Oh no, she's just the director. No, she's just the overseas. And she wasn't a doula, I don't think. And she did the training. Oh yeah, she's not qualified. Oh, yeah. I'm sorry. Nice. Great job, everybody. We're good. They're beautiful.
Chanel wants to come.
Oh yeah.
She's our doula trainer. She's the one who trained us.
Yes.
Yeah.
And they have a certificate from Chanel as well.
They do. It's in the back.
Yeah.
It's in the back.
That's great. Next year it should be double this size. The award or honoree, and then Deborah will have you come up. Okay? All right.
So I had the honor of working with Miss Ezzy. I used to work at Newark Community Health Center, and I had the honor of seeing Miss Ezzy in her work and seeing the way that she treats women, and she talks to women, and she's compassionate and loving. She might not be able to solve all their problems, but she is very loving and compassionate, and I think that that goes a long, long way. So Miss Ezzy, Miss Ezzy's midwifery journey began in Nigeria when she watched her mother care for pregnant moms and their babies in the village. So Miss Ezzy told me a story that she used to carry her mother's lantern for her while her mother went and caught babies. As a May nurse, Miss Ezzy did not feel confident to care for women in Nigeria until after her midwifery training. This is because as a nurse midwife, you also do domiciliary home delivery in rural communities. Miss Ezzy served briefly at a community hospital and a university teaching hospital, and was appointed to the School of Midwifery to assist as an instructor to the midwifery students. Then she went back to university and obtained a certificate as a midwife tutor, taught at the School of Midwifery for a year before leaving the United States in 1986. In the United States, Miss Ezzy graduated from William Patterson University in 1991 with a bachelor's nursing from UMD&J and with a certificate of midwifery and a master's of health science in 2001. Once Miss Ezzy graduated with her CNM, she started hospital deliveries at Wayne General Hospital, which is now St. Joseph's Hospital, in part-time clinic at Newark Community Health Center. When the maternity unit closed at Wayne General Hospital in 2004, she became employed full-time at Newark Community Health Center, where Dr. Clark is CEO. And they were doing deliveries at that time at Beth Israel. Miss Ezzy still works at Newark Community Hospital as a compassionate midwifery clinician, visiting postpartum moms every morning at Beth Israel, conducting centering pregnancy, and working with the SAVE program at Rutgers University in screening breast and cervical cancer. Miss Ezzy focuses on maternal and child health and is around reduction of preterm birth, low birth weight, and reducing infant mortality rates for Black women and within diverse and immigrant communities. So I have the honor of providing this to Miss Ezzy. This is from the Essex County Birth and Breastfeeding Coalition, who Jillian Fox-Majuda, are you in the house? And Takesha Miller. Hey. So these three sisters and I, we oversee the Essex County Birth and Breastfeeding Coalition. And this is the Essex County Birth and Breastfeeding Coalition. It's the MCE Honorea Award, which is Maternal Child Excellence Award Award or honoree, presented to Miss Edith Ezzy.
The Essex County Coalition, Birth and Breastfeeding, and the East Orange Success Family Success for putting this together. I'm out of words when they told me. I'm an ordinary midwife doing what we're supposed to be doing. And I have the privilege to be at the environment and the community that I serve. And it's a privilege to serve every woman, every pregnant woman, every woman to say around our community, especially in Essex County. And I have the privilege to also be working at NCHC, Newark Community Health Center, to meet most of those women. And we're trying our best. I know it may not be, it doesn't look enough, but we will keep trying. We'll keep trying. There's so much to do. Yeah, I read that the new. I thank the governor's wife and the deputy governor, because I read that Donald Trump has signed in something, and I read that part of it will be to provide providers where it's necessary. Where we don't have enough, we need enough, because we need all these women to start prenatal care early. That is the major thing. If you see any pregnant woman, anybody that misses a period, please, we warn them. And serious. we want to start early, because early makes a difference. It helps us to identify problems on time, and it helps us to solve the problem so that we don't have those premature babies. My son there was a premature baby.
I was.
I was taking my picture.
Thank you, man.
Yeah. He was a premature baby. I went through the journey, and I know what it is. It was tough. It was tough for these mothers. It was tough for everybody. And we went through a lot. He had oxygen throughout for a year plus. I went through that, and I pledged that I have to work to prevent premature birth. Premature deliveries is not what we need. That's what caused our high mortality rate too. So we will work. I know we have a panel. We'll discuss more about this. I will take your time.
Is Deborah Jennings, who is the co-executive director of the statewide Parent Advocacy Network.
So much has been said, and it has all been great. I first want to thank each of you for being here today, because this is a really, really important issue. This kind of just sends me back to 31 years ago, and just what that struggle was, particularly around breastfeeding and not having the support, and just saying on my own, I'm going to push through this, and being able to do that because of my own personal advocacy. At SPAN, we have a sort of a motto, and that motto is speak up, take action, and create change. And that is the motto that I have had throughout my life. And that's the model that we really are seeking to empower women and communities, people, children. Our work, when we were founded, our work started with birth, and then it went up to 26, and now we are pregnancy to 26. And it's because of speaking out. It's because of having wonderful staff members like Rachel, who don't take no for an answer. You know, Rachel seems so modest, right? She started out really modest and a facilitator, but Rachel is an advocate, and she is very strong in that, and that's what we. So much has been said, and I said to myself, we've talked about the statistics, and we talked about where we need to go. And so I said, I'm going to let Alice Walker talk for me. And she has a poem, copyright 2018. And it's for Daisy, Xenia, Petunia, Jasmine, Rose, Tenzin, Rebecca, Rachel, Braxton, Auden. The seed from last year's garden has been scattered by the wind. When I return in spring, tiny green faces are everywhere. Some have landed as we might, too, in dry and rocky ground. But Mother has returned, and she is the gardener. She notices the stunted plants, trying their best, still are stuck in rocky soil. Or maybe more discouraging from a young plant's point of view, in treacherous sand. Sand looks so solid, but is not, and winter packs it hard, like earth. And it is earth, but a very fickle kind. It slips, it slides, water drains right through it. But the gardener who knows, the mother to the plants, has come home. She sees. With her old and dullish trowel, she sets about her work. For days she has carefully noted all the uncomfortables. Now she moves. The stunted zinnias she can almost hear gasping for breath. She moves into pots. No matter that legend is, they dislike being moved. The impatience fainting in the heat, she transplants to dappled shade. The huge jasmine that never blooms, she leaves alone, except to shower it with a hose and tell it that, though perhaps it has forgot, she has not. Its function is to create heavenly scented flowers that look like stars. No more letting seeds struggle where they fall, as if there is justice in neglect. This is an Old or New Testament teaching we might decline. Placing our belief in the gardener, the mother of the plants, who always returns after the winter thaw, sees the condition of each one of her green children and acts to bring nurturance, happiness, and radiance to them all. Let us be the mothers of the plants. Let us take those actions and move forward so that we can change those disparities into non-disparities and really move forward for African American mothers and really for all mothers, because we all have so much to do and we have so many places to go. Thank you.